COVID-19. Professor Moffat lectures at the Regent University. He lectures microbiology, molecular medicine, and also nanotechnology. Prof, thank you very much for your time, and a good morning to you.
It's good morning, Senna.
Yeah, thanks for speaking to us this morning. I hope you're well.
By the grace of God, I'm doing well.
I am assuming you are also in partial lockdown.
I am, just like anybody else in Ghana, particularly in Kumasi, Tema, and Kasba areas.
And that should really affect your academic calendar, I believe.
It has. As we speak, the online lectures are in a limbo because of a lot of things. It has had a very serious financial impact on the college, and so students, even some of the students who can pay, they don't even know how to pay their fees. So we're having very, very serious challenges. And so what can we do? It's the ideal suggestion or directive from the government. So we just need to comply and then hope for the best.
I know this was not part of the plan, but just to get a sense, because you are also in the education sector, one of the things you are trying to do, and I understand from a lot of my friends who are still in school, they've indicated to me that a lot of you have tried to engage them through social media and using the internet, among others.
Yes.
How effective has that been?
Well, I must say that it depends on how robust the infrastructure is, and then also the availability of the infrastructure to the beneficiaries. So these are the two things. And so you live somewhere else and you are a beneficiary of the infrastructure, the online platform, you could benefit. If you are somewhere else and then maybe you can purchase, but you don't have it in your area, due to a lot of reasons, then it becomes a very big challenge. And so there are a crop of students who are really into it. In terms of all these challenges I've mentioned, they are really benefiting. But, on the other side of the spectrum, you have some students too who are not really benefiting. And we are trying to see how best we can rule them in so that everybody benefits. But it's been a very big challenge, I must tell you. Even the University of Ghana is going through the same kind of challenges. If you talk about the mainstream universities, they are also going through the same challenges. So we are trying to fashion out and streamline the process so that at least it will be beneficial to almost everybody to enjoy, so that we can still have some kind of academic sections going on. Otherwise, it will hurt us. What that means is that if we are not able to go through this, we will have to extend the academic calendar. And we are also thinking about students who are not from Ghana. Some of them are from Nigeria, elsewhere. So it's going to have a very, very, difficult, challenging effect on the students who particularly come from this area. So yes, we have some challenges, but we are trying to see how best we can streamline them.
And I believe those challenges will get worse if, for example, this lockdown continues through the rest of this month.
It would. And that is why, for me, I think we'll come to that in the course of the discussion. That is why, for me, I am not an advocate for a total lockdown. And I think maybe as the discussion goes on, you'll get my views on that. It would certainly have an effect on everybody. Whilst we are trying to look at the health aspect, we should also be looking at the economic aspect as well. And we have to create some kind of fine balance between the two. Otherwise, it will be skewed towards one area and it will not really help the others. So on the whole, it needs a lot of deep thinking, a very passionate discussion about the remedy, how best to tackle this in order to avoid a spread. It's not just, out of, emotional or anxious and some kind of impetuous decisions. We would fail and we would lose it in the long run. So it needs a lot of discussion at a very high level, taking into consideration all the varying factors that will make us, move on as a country. Otherwise, I think that at the end of the day, we would pay more than we are benefiting, and that is not what we would prefer.
Well, let me now take into the conversation on COVID-19, the virus itself. Now, we heard about it towards the end of 2019 in China, where it all started. initially, we were of the impression that this may perhaps not move outside the borders of China. Then the WHO came to say that actually it can be transported outside. Since then, a lot has happened because now even Europe is on its knees, America is on its knees. No matter how powerful you are, a lot of countries are on their knees. In Africa, we are now building up cases gradually. We are hoping that we don't get to their level. But what have we learned about COVID-19? The virus started, we were calling it initially coronavirus, then it was named COVID-19. But what have we really learned from the time when it all started till now?
All right. Thank you very much. And since we are now starting the discussion, I must say that good morning and good morning to your cherished online listeners. I think first of all, I was listening to your preamble. I think there are a few things that we need to correct. The first thing is that right now there's a pandemic from a disease called COVID-19. Okay, this disease is caused by a new strain of coronavirus called SARS-CoV-2. The SARS means severe acute respiratory syndrome. The CoV is coronavirus. And we have added 2 because we want to differentiate it from the SARS, which appeared in 2002, if you quite remember. And this particular virus, this new strain, has so far claimed more than 2 million lives in more than 100 countries. And I think that it's understandable that the menace has caught the attention of Ghanaians. Now, let me do this correction. The virus causing this pandemic is a new virus linked to the SARS. The disease that this virus causes is called COVID-19. So you see a lot of people kind of interchanging COVID-19 virus. The disease is COVID-19. And the virus that leads to the clinical manifestation of the disease is called SARS-CoV-2. So COVID-19, we are all learning. So let's say COVID-19, the CO stands for corona, the VI is for virus, the D for disease, and then 19 is 2019 December. That's when we actually discovered it. So that's just for the preliminary kind of education. And let me add that one of the difficulties in fighting this pandemic is that science knows very little about the new coronavirus. Very, very little. Okay, the family of coronaviruses itself is not that unknown, but the peculiarity of the virus and the specific characteristics of the disease which are associated with the virus are yet to be understood in full. And in fact, I don't even want to scare anybody this morning, but what we don't know is far more than what we know. And thankfully, knowledge of the virus is growing daily. And hopefully, we will get to understand the disease more so that we can, deploy more effective strategies to curtail it. So there are a couple of things that we know. And maybe I will start with what we don't know, because what we don't know, I think, is more challenging. Okay?
Very
If you don't, yes, right. So the first thing, and I always say this, anywhere I go, I talk to people, the first thing that we don't know is the real figures of confirmed cases and death tolls. It's one of the most basic questions, but also one of the most crucial. There have been hundreds and thousands of confirmed cases all over the world, but it's only a fraction of the total number of infections. And these figures are further confused by an unknown number of asymptomatic carriers. That's those people who have the virus but don't even feel. And most of the time when we are doing these computations, we don't factor them in. Okay? And most countries are currently very limited when it comes to testing. So we cannot know the scope of positive cases. And let me also add this. There are differences in the way countries account for positive cases and deaths. So, for example, if you go to France, only the deaths in hospitals are counted. Therefore, cases of very severe infections or deaths at home remain largely unreported. And some countries may also even lack the transparency with these figures for a lot of reasons best known to themselves. Okay, so everything indicates that the actual numbers of the infection are much, much higher than official ones. and therefore the real mortality rate of the virus could be much lower. And I think it's important that we get to know this. You see, the frankness with which we face the dangers would also energize us to do more to curtail it. If we play down the numbers and we don't think it's that serious, then we have this like a lackadaisical attitude towards it. So I think it's very important. So one, we don't know the real figures. And then two, the mode of spread of the infection. Okay, the mode of spread. We know that the main routes of entry, saliva, nasal secretions, cough, sneezing, and hand contacts with contaminated surface and so on. But it's been estimated that the virus can also stay up to about 3 days on plastics and steel, 24 hours on cardboards, and even in the air, what we call aerosols, up to about 3 hours. Okay, so when you have viruses which are in aerosols in the air, now the new science is telling us that they can also be a potential means of infection. In other words, somebody can be breathing, can be talking to you, the person is asymptomatic, okay, might be transmitting the virus to you. And that also confounds the whole argument, And so right now, people are asking, and I think it begs the question, should we wear masks and so on? At first, if you didn't have any symptoms, then there's no need to wear a mask. But now that we know that asymptomatics via aerosols can also spread the infection, for me, it's a very, very good idea that whoever is in Ghana, once you step out of your house and you go out there, you should wear a mask. Okay? But if masks are worn, they must be used and disposed of properly. I need to emphasize this to ensure their effectiveness. Okay? And the use of the mask alone is not enough to stop the infections. So it must be combined with, the rituals we're hearing all the time, frequent hand washing, covering, your sneezes and coughs and so on. So yes, the asymptomatics, to what extent do they also spread infection? So now we don't know. The other thing too that we don't know is recovered people. Do they have immunity to the disease? You see, the question of immunity is very, very important for understanding what will happen in the long term. There has been much speculation, but very, very little evidence on how durable any immunity to this virus is. You see, patients must build an immune response if they successfully fight the virus. But because the disease has been around for how many months? About 3-4 months? There is a lack of long-term data. Okay, so we don't know whether or not somebody who has been infected with the virus, okay, and showing symptoms of COVID-19, and then later has recovered, can still be immune to the virus or would be susceptible to the infection. We don't know. The other thing is that the virus is mutating, but the problem is how drastically is the virus mutating? So now we don't know that too for sure. You see, viruses mutate all the time. But as a general rule in virology, you expect viruses to evolve and to be less deadly in the long run. But this is not guaranteed for this new virus. And therefore, the concern is that if this new virus drastically mutates, then the immune system will no longer recognize it, and a specific vaccine will no longer work. And that is the danger. So imagine that right now there's a race for a vaccine. It's going to take about 18-24 months to come out with the vaccine. And by the time they come out with the vaccine, if this virus has drastically undergone mutation, this vaccine will no longer work. So the thing is, we don't even know to what extent this virus is mutating. And so it's confounding. Then the other thing too is the COVID-19. What is the origin? We don't know. Because if you know the exact origin, we can attack the origin. Research seems to confirm that the virus emerged in a city called Wuhan in China at the end of 2019. when there was a cluster of cases. And then the SARS-CoV-2, which is closely related to bats, okay, we then assume, because there's no clear evidence yet, that it jumped from bats through some intermediary host, and then it became pathogenic in humans. We don't know for sure. We know that, yes, it has come to humans, but how did it come to, was there a direct bat to human transmission? Or was there a bat and then was there the virus and it went through bats before the humans? We don't know yet. So that's a missing link. We don't know. And the fear is that if it could be a source of further infections, then we're in trouble. That missing link. So the missing link is there. We don't know for sure whether or not it is an intermediary host. And if it is, then we are in serious trouble. The other thing that we don't know, vaccines and treatments. There's no proven effective treatment. So current treatments are mainly from, our innate natural immunity, plus some other supportive treatments and so on. So there's a lot of talk about, a malaria drug called hydroxychloroquine, but nothing has been confirmed. And so laboratories around, all over the world are working very hard. But the fact of the matter is that the absolute treatment in terms of antivirals or the exact nature of the vaccine that will be adopted, we don't know. And so that's another problem. So you see, there are a lot of things that we don't know, and I'm not sure that you want me to go on, but there are a lot of things that we don't know. So for example, another one, the seasonality. You know that even though summer and heat are expected to slow the general pandemics of this nature, respiratory viruses in the northern hemisphere, based on the data that is available, it's not known whether this one will spread or be curtailed in the summer. We don't know yet, because if you look at it, in the northern hemisphere, they are battling with severe cases. And when it comes to the tropics too, we are equally battling with severe cases. Look at South Africa, look at Algeria, look at Morocco, look at Iran. So the virus is no respecter of environmental temperature. I don't want people to just be comfortable in the idea that, when we have extraordinary summer, we can get the viral load going down. It's not known. Nobody knows. And based on the data, my fear is that it will not even work that way. So that's another one we don't know. And people ask me, Prof, so this thing that is spreading all over, can pregnant women also pass the virus to their unborn children? It's a good question. It's a good question. I tell them at this time, there is not enough evidence to determine whether the virus is transmitted from a mother to a baby during pregnancy, or even the potential impact that it may have on the baby. We don't know. There's currently no evidence, even though it's being investigated. So I tell them, well, if you are pregnant, you should just continue to follow the appropriate precautions to protect, yourself from exposure to the virus. We don't know yet. Then another one, is it safe for a mother to breastfeed if she's infected with coronaviruses? Other viruses is not safe. With this one, we don't know. Science has to prove that. All mothers, regardless, in affected areas, or who have symptoms of fever, cough, or whatever, difficulty in breathing, you should seek medical care early and follow the instructions from the doctor. For asymptomatic mothers who are well enough to breastfeed, this includes, wearing a mask, when you are near a child, washing your hands before and after contacting the child, cleaning, disinfecting contaminated surfaces. This should be done in all cases where anyone who is confronted with the suspected COVID-19 interacts with others. So we don't know for sure whether or not, if you are breastfeeding, you can pass it on to your child. So Sana, maybe I'll end here by the unknowns. There are so many of them.
Okay,
and
so
it's baffling.
Before you go to the knowns, because the unknowns alone leaves you wondering if we are getting anywhere. Because a couple of words have been used. If so, for example, if somebody says you were treated of coronavirus, from what you're saying, that is inaccurate. You could say the person has recovered,
Exactly.
but not
Exactly.
treatment, because there's no treatment available currently.
Currently, yes. Yes. Good. Yes. Okay. So that brings me to another important question. A very important question. So why or how do people recover if there's no cure for COVID-19? Are you with me?
Yes, I'm listening.
So how do people recover then? And the answer is it's simple. Well, you see, the fact of the matter is that most respiratory viruses, including the coronaviruses, such as the ones that cause the common cold and so on, they are self-limiting, so to speak. And what it means is that they have a relatively finite period in the human body before they wear themselves out, or the immune system contains them, and then the patient recovers. So that is our innate human immunity fighting, and then you can recover. All right? So treatment currently for these viruses is aimed at relieving the symptoms in order to make the patient comfortable. Okay? Or keeping the infected person alive by supporting his or her organ systems which have been attacked and impaired by the virus. I'm sure you're understanding me.
Yes, I do.
Yes. So these are the ways by which somebody can recover. But in terms of having an antiviral that's attacking the virus itself, we are not there yet. Okay? So you can have a supportive, like I mentioned earlier, a supportive treatment or a definitive treatment. Okay? The definitive one is the one that entails treatment that are targeted at the organism itself, the definitive one. They are not there yet. So the supportive one are those that are geared towards eliminating, or relieving, if I should use the word, relieving the symptoms and supporting the various organ bodies to function. So these are how a person can recover. But what we don't know, what we don't have, and why we are not there yet, I can say, but we are not there yet in terms of vaccines and antivirals. So when you are sick or when you are positive for COVID-19, these are what you have to go through to recover, and not treatment, so to speak.
Interesting. Yeah. So that explains how come in a lot of cases the persons who are dying from this disease are usually old people.
Exactly. And it's very, very, very clear to us that those who are dying and who are old, most of the time, in 90% of cases, they have pre-existing, very detrimental conditions. And so they exacerbate the situation. And that's why they are dying very, very, very much so, as compared to the children. Okay. So if you take Italy has the oldest age group or bracket in Europe. If you take the world, you have a second, to Japan. And you realize that when we're having the numbers, they were explosive numbers because they had serious underlying conditions, and they were just dying. At that stage, your immune system has been so weakened; it cannot really fight off these disease, and so you just go very easily, as opposed to the middle age and then the children and so on. So that is why we seem to have the aged, just going rather quickly as compared to the others.
Another issue that comes up when we're just talking, that came up when we're just talking about the unknowns, is the question of how long would it have usually taken for us to find answers to these questions you have raised, and do we have that time?
That's a tricky question. That's a tricky question. I mean, let me start with the encouraging news. the research, the avalanche of research that's currently going on, gives me hope, gives me a lot of hope that not too long, not too distant in the future, we will come out with a special understanding of the way this virus works, and that will also equip us with better strategies to cater. If you ask me how long, now the vaccine, I know two companies. For example, there's a vaccine company in China that has started clinical trials this month, all right? And there's another one in the US that will start its clinical trial next month. And there's a race for the cure. So it's normally for vaccine onset to acceptance or approval, it will take you maybe, let's say, 1.5 years to 2 years. But sometimes, depending on the seriousness of the situation, the CDC can allow you to skip some of the processes and then go to, maybe instead of going from clinical trials, phase 1, phase 2, phase 3, and so on, they can say, okay, go to phase 2, all right? And so it will expedite the process. And so even though normally to take about 1.5 to 2 years, I'm thinking that it will take, in a year's time, it should come out with a vaccine that has been documented to work, that is safe, that is efficacious, and that is also in abundance for we, the Africans, to also benefit from it. So yes, I believe that we will get there. But that is on the vaccine side, okay? That's on the vaccine side. But when it comes to the antivirals, currently, I don't know of any research company really working on the antiviral. That is, what medication to give to attack this strange virus itself. There's nobody really working on that, so I can't say for sure. But the vaccine is where the entire scientific community is looking at, and so we believe that in a year's time. And then let me also say this: looking at the way the Chinese are running, so to speak, I think that they'll be the first to come out with the vaccine. They will be the first to come out with an effective and safe vaccine against this virus. Because they were first, if you remember, they were the first to sequence the entire genome of this virus. They were first people. And they made it publicly available to public health institutions, to academic institutions, to various countries for them to work on. So I think that, yes, that's the good news. Looking at the tsunami of research that is coming in, I think that, with time, and not too distant in the future, we'll be able to come out with some kind of antidote, and that will relieve all of us.
And then the other aspect, because you just spoke about sequencing, to what extent would the fact that Ghana has also been announcing that they've also been able to sequence the disease help in understanding the disease, also maybe produce a vaccine that works for us?
Well, like I told you earlier, China did it first, okay? Now, what Noguchi has done, for me, I don't want to downplay their effort. They've done extremely well. But the genome already existed. But what they have done is, for me as a Ghanaian, as a scientist, I think it will catapult Noguchi onto some kind of international platform to be regarded as a full-fledged and credible medical science institution. For me, that's what it is. And so, if you look at the whole of Africa, it's only Noguchi that is able to do that. And so, I think that credibility is what would inure to our benefit. And then the other thing too is, even though the genome, the sequence was made available to a lot of other countries, we are not now going to, ask requests for the sequencing from China and so on. We have it at our doorstep. So we can do whatever, we can engineer it, we can manipulate, we can modify, just to see what effect it will have if there's a mutation. So we can do a whole lot of things at our doorstep, and it's going to be faster because we now know the sequence. Okay. And the other thing too is the tests that are currently being done, the PCR tests, because we now have the genome sequence at our doorsteps, and we have a lot of people working on the various aspects of the genome, we can also equally, or even better still, pick certain sequence that would help faster and more reliable in terms of testing for the virus, okay, using the PCR machine. So yes, it is good. I mean, I think it's very impressive. It's a feat that I really applaud them for doing. So it will help us in the long run. But as to whether it's a new thing out there, that is not really new. But we as scientists in Ghana, it will help us as we move forward.
Prof, I know we are running a bit ahead of the time we had given you, but a couple of issues, because one, you didn't deal with the issue of the knowns. What do we know?
Well, Sana, I think the first thing that we do know now, what we do know, in fact, everybody in Ghana knows, is that it's a contagious disease. That we know. It's a contagious disease that spreads easily and even geometrically. You know, because it's estimated that without the containment measures, an infected person will infect an average of 2 or 3 other people. So if Mr. A is infected, don't think of only one infection. The next day when you come, you are thinking about 2 or 3 other people who have been infected. And that is the danger about this virus. So we know that. Okay. The other thing that we know is that, you know, scientists are pointing out the coronavirus spreading quickly. It's because it's invisible. So in many cases, around 50%, and in fact, potentially more, it has not caused symptoms or only mild symptoms. So although these cases may be approximately 50% less contagious than those with more advanced symptoms, their large number would be a very important contributor to the spread. So that one we know. We know there's a contagion. The second thing that we know is that, and this one, I've said it almost everywhere I go, we know that the lack of preparation in many countries has brought us where we are now. Lack of preparation in the face of the pandemic, combining the slow reactions, has brought us where we are now. In Asia, they are better prepared because, you know, they've had other epidemics. And so they were more disciplined when it came to the particular one, protecting themselves and so on. And then you also add this, you know, globalization greatly facilitated the virus spread. The fact that it has appeared in a city called Wuhan, a city of about 11 million people in China, okay, in China, a country considered to be, if you like, the factory of the world, hyper connected to land, you know, by land, sea, and air to so many other countries. Clearly, it has also favored this unprecedented situation. So that we know. The third thing that we know is the ignorance about the virus. A reason also for where we are now. There are so many questions about the influence of the Chinese authorities in their research. Fine, we don't know. They write a lot of Chinese, we don't understand, and so on. But initially, if you remember, the flagging of the symptoms such as fever and cough in the early stages of the pandemic as the main signs to isolate the sick was also a misstep. Why? Because it ignored the fact that carriers or asymptomatics could show no symptoms or mild symptoms but still spread the disease. And this in turn slowed the authorities' capacity to slow the spread. So that one too we know. The other thing that we know is that it was not created in a laboratory somewhere or genetically engineered. And in fact, the scientific and factual analysis so far unambiguously confirm that this is a naturally occurring virus. So we know that one. And we also know the risk factors, and this is very important. Age is a risk factor. The underlying existing conditions, like I told you earlier, hypertension, diabetes, cardiovascular disease, chronic respiratory, these are all risk factors. And then the state of the person's immune system is a risk factor. The genetic factors of that particular person is a risk factor. And here's the latest one, which even makes this virus so difficult. The latest one is this. Blood groups have also been studied, and those belonging to blood group A seem to be more vulnerable. We know. So you see, understanding all these risk factors could help us in understanding the way the virus works. The other thing that we know is the symptoms, and I think the symptoms we all know. Okay, the fever, the cough, the sneezes, and so on. But a very important question was whether the asymptomatics can spread the disease. And of course, we now know that it's possible. And it could potentially be infectious without knowing that it is. So these are what we know now. But as you can recall, what we don't know are more than what we know.
That's interesting. And the key question, the things we do not know are the key to unraveling the virus.
Exactly. And it so happens that there are more. So you can imagine where we are now. So I think right now, the key is we are all targeting the cure. And that's why there's a race for the vaccine production. And I think with the coming on board of the vaccine, then scientists can then look at the spread, the mode of spread of the virus. They can look at other areas of the virus spread, and then we can also have answers to that. But right now, the thing that we all need to know or to have is therapy, cure by vaccines, and that's what almost every other biotech company and the pharmaceutical companies are doing right now.
Well, in Ghana, we have recorded 641 cases so far.
That's correct.
That's the number as at this morning, and I'm just looking at the website of the Ghana Health Service. So it means that the figures have not changed. From what you are saying, you said earlier, it means that even these 641 cases can be deceptive because we can't tell the exact numbers that have the disease.
Absolutely so. Absolutely. And you know why? I think I said earlier, it's just because even though we are doing what we call enhanced contact tracing, it's impressive, it's good. But ideally, we need to do mass testing. And because no country can do that, the figures are not exact. Are you with me? Yes. They are not exact. And that's where we are now. Okay. That's where we are. In fact, for me, that's the danger. The fact that people can go undetected and they are spreading the virus. The revelation now about the possibility of spreading the virus from the asymptomatics through breathing or even speaking, talking to you, is a revelation. And that's why I told you earlier that for me, I'm one of the strongest proponents of the wearing of masks outside. Everybody, when you go, I don't care who you are, you should wear a mask. The fact of the matter is, based on all that I've said, you don't know who you are talking to. And the person can be alive, giggling, smiling, hearty, strong, talking to you, but then he could be spreading it to you. And now that we know another mode of spread, please wear a mask. And we will be doing ourselves and our families good.
And then let me end by asking what you make of the steps we've taken as a country to deal with the COVID-19 pandemic.
Well, I think we have done well so far. I think based on our, if you like, our limited resources. You see, what we did, which I think is very impressive, is we added the advice from the scientists to our limited resources, and that's what has gotten us where we are now. So that is what brought this enhanced contact tracing. And in fact, it's impressive. And in fact, we are being lauded by even very senior eminent health scientists. We've done a lot of work in terms of how many people we have tested so far. You forget about the undetected. 50,719. And out of this, we have 641 as positive. And 8 deaths, unfortunately. Someone will say the 17 who have recovered. How come the recovery rate is low? Well, on the whole, in the African continent, the recovery rate so far is around between 9 to 9.4%. as compared to the recovery rate, okay, in advanced countries between 60 and 70%. But I mean, you don't need to be a brain scientist to know that we are challenged with our medical health system. We are not endowed with the needed equipment and infrastructure, the resources to be able to put the infected at ease. And even when you go to the outside the advanced countries, they're also having challenges. So when you look at the African terrain, I think that based on the challenges that we have, it's not surprising that we are seeing this low recovery rate. But again, it's a step in the right direction. So for me, I think that Ghana, we are doing well. We are doing well. In fact, right now, we have even expanded the testing centers. We initially had 2, if you remember, Noguchi and then the KCCR in Kumasi. Now we have added 3 more, okay, which are all being resourced to do the testing. And I think we can even, based on that, we can even do more testing, get more positives, isolate them, and then we can get moving. But this is my problem. When you suspect a case and you take a sample and you go and test, it takes about 1-2 days to get a test. Okay? Now, once you've taken the sample to go for the test, you don't know whether that sample is going to be negative or positive. So the person whose sample you have taken, if the person goes out there to mix with the population, by the time you come back with the result as positive, I'm sure you know where I'm getting to, Senna, he would have infected others. You see that? He would have infected others. And so we if we don't take care, we'll be taking 2 steps ahead and maybe 1 step backwards. But if you're able to nip this in the bud, and that's what Taiwan did, and that's why I think that the Taiwanese example is exemplary by all standards. You know, when they test you, they quarantine you. And when they quarantine you, they use GPS to make sure you don't move out of your locality. They can track you when you are moving out of the zone. And then you will be dealt with severely if you are doing so. And what even made the people not want to move out is that they also gave them some monies. So they were giving them dollars to just stay there until we come out to the result. We would feed you, we'll give you money. But if after all this you move out, we would make sure we deal with you. And it worked. Okay, so that would be my challenge if you're not doing that. But if we are, then I said so far all well and good. And I think with the coming on board of testing centers, I think we will get more results. And that will tell us how well as a nation we are doing. But seriously though, if you ask me whether we are moving in a direction that is good, I would say yes. If you want me to put percentages, I will give Ghana for now anywhere between 60 and 70%. And we are not doing badly. So let's all support the government. If you are not there in the hospital, my advice is go through the ritual. And the ritual, I don't repeat it because we've gone through several times. Make sure you wash your hands frequently and the running water with soap, and the length of time, not less than 20 seconds. Every time you go out there, make sure that you disinfect, you sanitize. If you come back home, you sanitize all surfaces. If you keep on doing this, I think that to a very large extent, we will help the government in curtailing it. And who knows? Maybe you and I, the lockdown will be lifted, and then we will go into society again and do our normal life.
I said that was my last question, but you promised to argue for why you think the partial lockdown is the best way and not the lockdown. Now, explain to us why you think so, and then what we should be doing during a partial lockdown to ensure that we do not worsen the exposure.
Well, I think during the course of the discussion, I think I've made mention of some countries as being exemplary. I think I've said it over and over again. And that is why their numbers are going down and down and down. And I think I've just told you about what the Taiwanese did, and what the Chinese did, and what the South Koreans did. And the reason why they did that is they had a battle of SARS previously. And so I wouldn't say they were expecting it, but they were prepared for it, if you know what I mean. Okay. So the Taiwanese, for example, I mean, when the outbreak of SARS in 2003 emerged, they set up a central command center. And even before anybody, including WHO, declared anything, Taiwan was already testing flights into the country from China. Nobody had done that. Don't forget, about 3 million tourists move from China every year into Taiwan. Now, let's contrast that with UK. The UK was very reactive. Schools were still open. People could easily travel. The USA was in a state of denial. I listened to Trump, who said it was another flu and it will go away. People can't get tested because there was not enough test kits. That's what he said. So what's Taiwan's secret? They learn from the hard lessons, and then they use what I call tracking mandatory quarantine. I think I explained that to you earlier. Okay. So now let's look at Africa. You see, the case of Africa is stunningly different. Our economies are dominated by the informal sectors. Millions of Africans are unable to survive without some form of daily trade, and they don't even have the luxury of bank savings and online commerce. Some of us at home, we can do online commerce. They don't have that luxury. In Ghana, with Accra and Kumasi and Tema undergoing a 3-week lockdown, vendors whose businesses depended on the proximity to the now closed schools and offices and even the toll booths, they disappear from the streets. Okay? So the government will likely face a pushback from citizens if there is even a contemplation of a total lockdown. Now, don't get me wrong, ideally, Ghana needs a total lockdown, ideally. But in my humble opinion, I think that when the country is on a total lockdown, there will be chaos and discomfort in the system due to the lack of food. And and what shall we do, really, in a situation like that? Again, Senna, don't get me wrong, but Ghana does not have the financial capacity to load down the country, because the government will then find it very difficult to pay salaries of public workers, as well as even support the private sector to pay its workers. All right? And if you think about an effective lockdown, it requires that an extremely wide range of measures have to be in place to support people. Do we have that in place? Can we churn that out? So although the decision may appear expedient at the moment, the government needs to consider the dangers it will pose to the economy. A total lockdown will mean that every sector of the economy, other than the essential service providers, will be in total shutdown from the operations. I believe that such a stay-at-home order will crumple the economy. And so, generally, an order of this kind of nature requires sober reflection. Don't let's be too anxious and emotional about it. And I believe it also requires an honest appreciation of Ghana's economy. And until the government has done that, it should not, kowtow to, the impetuous, Ghanaians. I would rather advocate, a more flexible working hours and working shifts to be introduced at both the formal and informal sectors. And even at that, I'll even go further to say that these people who will be in the system to work should have been tested. Okay, so it will create some kind of a balanced system. So it will not be total, but will be cushioned somehow for the economy to run. We can discuss the permutations and the various dynamics later, but for me, this is my humble advice and my opinion. Until that is done, we shouldn't rush to lock the totally lock the country down.
And Prof, the way you said we can discuss it later means that you've already booked a date yourself.